Good afternoon, everyone, and thank you for attending today's webinar, 2016 Healthcare Hiring and Compensation Trends, presented by Rachel Cummins of Robert Half. Please be aware that there will be a question and answer portion today at the end of the webinar. To avoid frequent interruptions during the webinar, please type your questions in the questions box located on the right of your screen. They will be answered in the order received during the question and answer period. Additionally, an electronic version of this presentation will be emailed to all participants following completion of today's webinar, and a recorded version will be available on the website for members only. Again, New Jersey MGMA would like to thank you for attending, and I will now turn things over to Rachel.
Hi, thank you, Alex. Hello, my name is Rachel Cummins, and I'm the practice manager of the Northern New Jersey Robert Half Healthcare Practice, and I'm pleased to be speaking with all of you today. And I will be speaking about the current hiring and compensation trends in the healthcare industry. So some of the data I will review with you today comes from our annual on their intimate knowledge of their hiring markets and the thousands of full-time and the interim placements that the year. And our guide is widely used by employers, job seekers, academic institutions, professionals associations, and the media and government agencies. In fact, research entities such as the Bureau of Labor Statistics have consulted our salary guides for comprehensive compensation and hiring information. And we also conduct research on workplace trends that could impact salaries and survey senior executives, senior managers, and employees on current issues. We reviewed actual starting salaries from 2015 and predicted compensation trends for 2016. So before we get started with our discussion about hiring and compensation trends for the healthcare industry, I'd like to provide a quick overview of Robert Half Healthcare Practice and what we do. So Robert Half Healthcare specializes exclusively within the healthcare field, placing temporary and temp-to-hire healthcare administrative, revenue cycle, and accounting and finance professionals. So we are experienced in the healthcare staffing service and in the industry, and we do, commit ourselves to meet all temporary and temp-to-hire staffing needs that do come across our desk. So these are the types of positions that we place in healthcare organizations. Our experience gives us unique insights into the opinions of employers and job seekers as it pertains to hiring or seeking a job. So these are the bulk of the positions that we do staff. Of course, there's specialized roles as well, but this is for the most part. Okay, so as far as today's discussion, so as you can see, we do have a lot of ground to cover today. Healthcare employment trends, types of healthcare personnel in demand, hot roles and compensation trends, the regional overview, recruiting and retention strategies, as well as salary negotiation tips. And as Alex mentioned, there will be a Q&A at the end. So let's first take a look at what's happening with healthcare employment. So the bottom line is healthcare employment is on the rise, and it has been for a while. The healthcare industry is currently a leading sector for job growth in the United States, and healthcare employers have added more than 500,000 new jobs to the U.S. economy over the past 12 months, according to the BLS. And the BLS also projects that between now and 2024, the U.S. healthcare industry will see more growth and will create more new jobs than any other sector. So an estimated 2.3 million positions. Sorry guys, I think I skipped ahead here. Sorry about that. So what's driving employment in the healthcare industry? A number of factors, and many I'm sure that you're aware of. The aging population is creating a need for more healthcare professionals. So the U.S. Census Bureau projects that by 2050, the U.S. population aged 65 and over will be 83.7 million. So essentially doubling from the 2012 estimates. And baby boomers are largely responsible for this increase as they began turning 65 in 2011. Then we have healthcare reform, which continues to redefine how healthcare is offered and delivered, and it's also affecting hiring. So as payers and providers manage more members and patients as a result of the Patient Protection and Affordable Care Act, for example, they need more financial staff, especially in accounting and operations. Stronger emphasis on revenue cycle improvement by providers is another factor driving healthcare hiring. So providers want to maintain a streamlined revenue cycle to promote a healthy bottom line. They're adding processes and hiring staff to better mitigate financial, regulatory, and operational risks. And the growing adoption of value-based reimbursement contracts is also expected to create new positions and processes within finance and operations. And lastly, mergers and acquisitions activity in the sector, particularly consolidation in provider and payer segments, is having an impact on employment. So organizations are striving to gain operational, technological, financial, and product efficiencies. And this is often requiring the addition of financial, rev cycle, and operational staff. So technology changes are also influencing job creation and hiring in healthcare. Many providers, big and small, are modernizing their operations. So for many providers, the decision to modernize has been driven by compliance mandates, such as HIPAA or the Health Insurance Portability and Accountability Act, and HITECH, the Health Information Technology for Economic and Clinical Health Act. But others are simply embracing new technologies in order to provide better patient care and increase efficiency, innovate, and stay competitive. So providers continue to move paper-based records of patient care and health histories to electronic medical records and electronic healthcare records. And many are also implementing healthcare management systems. And as they do, they need specialized assistance to ensure compliance with relevant regulations. And of course, big data is having an impact on healthcare hiring as well, just as it is in the business across industries. Healthcare organizations are relying more and more on data and financial informatics to understand how to provide more cost-effective and quality care. And the implementation and upgrade of practice management systems, EMR and EHR, are providing the business and leadership with more insight into patient and membership populations and how to better serve them. This trend is also creating a demand for specialized expertise in healthcare, which we'll talk about more shortly. And lastly, new ways of providing patient care, such as telemedicine, which is the use of communication and information technologies to provide clinical health more remotely, and other innovations are opening up new career opportunities for professionals in the healthcare space. Okay, so now let's look at some of the types of positions that are currently in demand in the healthcare industry. So many healthcare employers need to hire accounting and finance pros, revenue cycle specialists, administrative support, and specialized consultants. So let's look at the types of roles that are in demand and what level of starting compensations employers are offering skilled candidates for some of those jobs this year. So here are some of the hot administrative roles in healthcare this year, from medical schedulers, medical receptionists, EMR specialists, credentialing specialists, medical data entry specialists, medical customer service reps, executive and administrative assistants, patient registration and admissions clerks, and insurance referral and verification coordinators. Especially now that more individuals are covered by health insurance due to the ACA, a lot of offices have needed to add administrative support staff to help with an influx of new patients, whether it's heavy scheduling, verifying all insurances and eligibility, or even getting a centralized scheduling system and call centers to help support these calls coming in and getting these patients taken care of. So skilled administrative professionals are also earning higher compensation this year for these and many other roles. The percentage figures in blue represent the increase in the level of compensation for 2016 compared to 2015. So please keep in mind that all of the salary figures that you see on this and similar slides coming up, they're national figures. And we'll talk about some market-specific trends later on in the presentation. So here's a list of the revenue cycle roles in high demand this year in healthcare as well, from medical coding and billing specialists, patient account reps, reimbursement specialists, medical collection specialists, payment posters, insurance specialists, claimant processors, as well as claims and revenue cycle analysts, and patient accounting specialists. Especially in my sector up here, a demand in medical collection specialists to help with denials and AR has definitely spiked up this year as well. But across the board, I feel the revenue cycle is definitely in high demand at this current time. And here again, we are seeing compensation trending up for many revenue cycle roles this year, including these positions. And lastly, here's an overview of some of the hottest accounting and finance jobs in the healthcare industry for 2016. Senior and staff accountants, AP specialists, bookkeepers, reconciliation analysts, payroll, financial reporting specialists, cost analysis, tax and audit staff, financial and senior financial analysts, and budgeting and forecasting analysts. And especially as far as Robert Half and our core accounting and finance teams, they've been seeing a demand for financial analysts to help with revenue optimization within practices especially. Again, salaries are up for these and many other roles within accounting and finance. And keep in mind, specifically for our area is 30% above the national average for compensation. So for these numbers that you've seen, be sure to multiply these salaries by 1.3 for the most accurate data as far as it relates to our local area. Oops, sorry guys. So as I mentioned earlier, many employers in healthcare are in need of specialized talent for business systems, compliance, and big data projects. Many are engaging highly skilled consultants for these initiatives and other projects of limited duration. So some of these in-demand expertise, these employers seek, I don't know why I keep skipping here, I'm really sorry guys. They're seeking regulatory reporting, audit prep, business system implementations, business intelligence, and process improvement. Sensitive. Okay. So now that we discussed hiring and compensation trends nationally and locally, let's examine some of the strategies for attracting and retaining top talent for your healthcare organization. So in competitive industries like healthcare and finance, it can be challenging to find and retain the talent that you need for your organization. So these three essential recruiting and retention strategies can help. So number one, offer competitive compensation and benefits. So this may seem like obvious advice, but it's important to always keep in mind the large role that compensation and perks play in a professional's job satisfaction. So our salary guides are a useful resource for confirming that you're offering starting compensation that's in line or even above market rates. And secondly, support career growth and work-life balance. So I would be sure to provide a well-defined career path for healthcare professionals and maintain the type of work environment that would persuade them to stay with your organization for the long term. So it could be especially tough to maintain work-life balance in a high-intensity industry like healthcare. So anything you can do to help your staff better manage their work and personal demand is definitely a huge plus. And three, provide training and certification support. So professionals at healthcare organizations want to build their skills and stay current with the industry trends. By offering support, by offering training opportunities or reimbursing employees for obtaining certifications that help build their skills, This not only demonstrates your commitment to the growth of your staff, but your organization will benefit from a more skilled workforce. So salary negotiation. After a candidate responds to your job order, you must be prepared to negotiate the salary. Why? Job seekers today have access to an abundance of information on how to negotiate salary through websites and other resources, so most will enter the meeting knowledgeable on the topic. So to reach a fair deal, you'll need to be equally prepared. If the candidate suggests a higher figure than you've offered, you can choose to raise the amount of your proposal and wait for the candidate to respond, or to make a counteroffer. Ideally, you'll arrive at an agreement within the salary range that you've set for the position. If the candidate keeps pushing, whether you want to exceed the established range generally depends on two factors. How badly do you want the individual, and the policies and the precedents in your company. So during that time, I would consider these two questions. Number one, are other equally qualified candidates available if the applicant says no? And right now I know unavailable or skilled talent is, the market is pretty tight as unemployment is at its lowest. So that is a huge question to consider if there are qualified candidates available. And if yes, the leverage to make accommodations rests, with your organization and the company. And number two, has the job been particularly hard to fill, or are market conditions making finding and recruiting suitable candidates difficult? So these are two very important factors to consider when, coming up to the salary negotiation aspect. So keep in mind, if you decide to negotiate salary and go beyond the pay scale you originally had in mind for the position in order to win a really stellar candidate, you risk poor morale among existing staff should they learn that a new hire in the same role is being paid at a higher rate. And if you're not able to match a candidate's salary request, consider expanding other components of the package. So applicants are often willing to compromise on base compensation if concessions are made in other areas. So those are two very important things I would consider during that process. And thank you for your time today. I hope you found this information useful, and I would love to answer anyone's questions if you happen to have any.
Okay. We have one question. How will the proposed increase in the minimum wage for New Jersey affect the salaries in healthcare practices? Are the practices going to make increases to big salaries in range?
That's a great question. And unfortunately, a lot of times it comes down to a case-by-case situation. And that's why we like to provide this information with the projected hiring trends, because it's important that these organizations are informed of these salary trends which are increasing, because individuals will be expecting these types of amounts, and then they certainly want to be considering that when it comes to the salary negotiations and such. So I'd love to be quite simple that everyone is going to raise their salaries and hourly rates, but I think it's truly a case-by-case business, and that by different organizations and facilities.
Okay. Does anyone else have any other questions?
And also, this information from our salary guides, whether it's accounting and finance or the administrative, I could also provide, this information electronically. If there is information, emails and such, if anyone would like this info to kind of review as well at your own pace, or even, just kind of keep in your top drawers a reference. It is very, very useful information that is utilized by many, different organizations, including, the Bureau of Labor Statistics. So I can most certainly shoot that information over to anyone who may want it to review it and kind of hold on to it, as well as any other information that you might want as well, as far as, the info that we do have.
There was a question, can we get the salary numbers you showed regionally?
So normally that's going to be within our salary guides that I can send out to you, and it does break down not only our area, it breaks down the entire country regionally. So I can certainly send that out. It's going to have the main numbers like you did see, and it's just a little bit of throwing some math into the mix. In the back of the salary guide, they will show every local region and what their local variance is for the national average. So you can then apply that to these numbers and get a true read for each different region within the United States. So I can definitely provide all of those numbers over to you.
Okay, and if you want to send that to me or Dawn, and then we can put that with the presentation when we send it to the attendees.
Excellent. So I can send both over.
Okay. Do you have any compensation trends for LPNs, MAs, and admins?
Unfortunately, not the clinical staff. That, unfortunately, we do not have, as you know, mostly we focus in the administrative rev cycle and, of course, the accounting and finance. As far as the administrative positions, depending on which role you're thinking of, we do have it broken down into different categories, whether it's, you know, medical administrative assistants, or any type of admin staff. But for clinical medical assistants and other clinical staff, unfortunately, I do not have that on hand, but it's definitely something I could look into and possibly provide if someone else does have.
Okay. Are there any other questions? And if there's no other questions, we will close the webinar. And just a reminder, it will be emailed out to all of the attendees, and we'll be sure to put the salary guide in there since we have some requests for that as well.
Absolutely.
Okay. Thank you to everyone for attending.
Thank you so much. I hope you found the info useful. Thank you so much for your time.